Welcome to the Medicare Easy as Pie Show, brought to you by Mesa Benefits, your guide through the Medicare process with Stephanie Garcia-Hagan.
Good morning. Welcome to the Medicare Easy as Pie Show. I'm your host, Stephanie Garcia-Hagan. I'm the co-owner of Mesa Benefits, and we are your guide through the Medicare insurance process. I co-own our agency with my partner in life and in business, Bruce Hagan. Bruce, welcome to the show today.
Well, welcome.
We live, work, and play together and love every minute. Right, Bruce? Every minute.
Every minute.
We're an insurance agency that specializes in Medicare insurance. Whether you're newly eligible for Medicare or have been a beneficiary for years, we are here to help. Bruce, welcome to the show.
Do you think people actually believe that every minute thing?
Yes.
Do they? Okay.
think
Okay, let's go with it.
If they've been around us for any length of time, they know that we get along pretty well. It's not an act.
Well, I'm not saying we don't get along. I'm just saying I don't know if you can enjoy everything you do every minute. I think that's a stretch.
Okay, listeners, are we
90% of the time? How's that?
Okay. Apparently, I'm not on the same page with my husband, so I'm going to need counseling. So, y'all listening
More counseling?
should be really... You should feel really sorry for me because I thought he loved every minute.
Okay, let's just rewind. There we go. Every minute, you bet. Let's go. Let's roll.
Thank you. I appreciate that. And he tells the truth all the time.
Walked yourself right into a trap there.
I did. More counseling.
I love it. Okay, we operate the agency on three main principles. The first is that you, the beneficiary, are in charge of the decisions relative to your Medicare insurance options. There are lots of options out there, and your health, your lifestyle, and your budget are the deciding factors for your choices. We make a living as insurance agents. Obviously, we get paid to help you make those decisions. I'll let you in on a well-known secret. The commission that we receive on your policy choice is exactly the same no matter which Medicare Advantage or prescription drug plan you choose. Supplement or Medigap insurance commissions are based on a percentage of the premium that you pay in most instances, and that percentage equates to about the same as if you choose a Medicare Advantage plan. The bottom line is we don't benefit from steering you to one company over the other. If you want a $0 premium for Medicare Advantage, we can do that. If you sleep better at night paying a premium for a Medigap plan, we can do that too. The second principle is that we mentor and support other agents and agencies with their insurance businesses. We won't partner with an agent or agency that doesn't operate their business with the beneficiary being top of mind. The final principle is that we follow all of the regulations enforced by our regulatory bodies. I would like to know who wrote that sentence, and they should be taken out because regulatory regulations, that's a lot. You know what? I'm a real person, everybody. I can't always read what I write. Oh, in our case, that's CMS, the Centers for Medicare and Medicaid Services, and boy, there are a lot of regulatory regulations, and we follow them all. We definitely make sure to follow them all. And one of the biggest ones, and the ones that has given most of my Bruce and me and our agents and our agency partners the biggest kind of pause, is this 48-hour scope of appointment rule. Apparently, it's been in effect for a really long time, but we never really had to use it. And we have to have a scope of appointment 48 hours before we meet every beneficiary, unless you call in or walk in or stand on your head. I don't know, but we have to have a scope of appointment 48 hours before an appointment, and we follow that rule, and we can text them to you, and we can email them to you, and if you miss it, then I guess we have an appointment 2 days later. I don't know. We'll all figure it out as we move along, but we are definitely going to be compliant. All right, here on the Medicare Easy as Pie Show, we break down the very complicated Medicare insurance system into 4 tasty slices of pie to hopefully make the Medicare insurance process easy as pie. So let's dig into today's slices of the Medicare pie, shall we? Obviously, we are heading into the annual election period. It's next Sunday. If you know that you need to make changes or just want to do an annual review, Mesa Benefits can help you do just that. Please call our office at 970-549-0410 to make an appointment with Bruce or me.
See, there's the phone number.
Good job, Bruce. Slice of the pie number 1. Why would you even want to make any changes? There are several reasons. First, is there a change to the network for your Medicare Advantage plan? Did the doctor you see change? Do you need to access care at a facility that's not in the network that your current plan uses? Long and short of it is that you can make a change to your Medicare Advantage or prescription drug plan for any reason that you choose. You don't have to have a justification for the change. You just get to make it. We're going to dig into some of the reasons here, There is also a new insurance company in Mesa and Delta counties for 2024. The company is called Select Health. They are in town because of Intermountain Healthcare. You recognize the name because they are the company that recently acquired SCL and St. Mary's Hospital. Select Health is owned by Intermountain Healthcare. Their plans are competitive, and if you use St. Mary's providers, it's a good plan to look at for the coming year. Slice of the pie number 2. Did the premium for your prescription drug plan change dramatically? We are seeing lots of changes to premiums for standalone prescription drug plans. Some are going up, some are going down. The biggest thing that we are seeing with prescription drug plans is that we need to be diligent about the formularies too. Please make sure that the prescriptions you take are still covered in the same way for 2024 that they are now. There are some major improvements to the prescription drug world because of the Inflation Reduction Act recently passed. These changes are proving to be beneficial for drug costs. The stages for Medicare drug coverage have changed slightly, and it's very important to check your coverage and those prices. There are some of you out there that don't take a lot of drugs or any at all for that matter, and have a really, really low cost option and Bruce and I can tell you about it. Slice of the pie number 3. Have you been in a Medicare supplement plan and might want to look into an option of a Medicare Advantage plan? If you've listened to the Medicare Easy as Pie show even once, you'll know that I love a good story, so today is no different. So let's meet our made-up couple for today's show, John and Sally. They're married, they're high school sweethearts, and have been married over 40 years. They are an inspiration to all of us because of that long longevity of marriage. They have 2 kids and are both on Medicare, though Sally is still working. When they first were eligible for Medicare, John and Sally chose Medicare supplement plans that covered a good majority of their out-of-pocket costs. They don't pay copays or coinsurance, and their Part B deductible is very low. They have been very happy with their plan, with everything except the monthly premium. John and Sally have made an appointment with Bruce, and they want to discuss Medicare Advantage. They've heard a lot about them, and they talked to their next-door neighbor who has a Medicare Advantage plan, and he said that he doesn't pay a monthly premium for his plan, and he even has dental coverage through the plan. They want to know more about this option. Bruce goes through the 3 options available to Medicare beneficiaries. He explains what they have and what makes Medicare Advantage plans different. He goes through the plan benefits, costs, copay and coinsurance amounts, extra benefits, and how to access care. He checks to make sure that their doctors, specialists, dentists, eye doctor, and the facilities they use are all in the network. And once they determine that the plan will fit their needs, they are intrigued and ask the question that all folks ask in this situation. What if I start the Medicare Advantage plan and I don't like it? John and Sally, you can go back to your Medicare supplement plan with no underwriting requirement. You would qualify for a special enrollment period to go back to your supplement plan called a Medicare Advantage trial right. You don't have to undergo underwriting questions. You just go right back to the exact plan that you had to begin with. In fact, this rule is clearly stated on Medicare.gov, and here it is. If you join a Medicare Advantage plan for the first time and you aren't happy with the plan, you have a trial right under federal law to buy a Medigap policy and a separate Medicare drug plan if you return to original Medicare within 12 months of joining the Medicare Advantage plan. If you had a Medigap policy before you joined, you may be able to get the same policy back if the company still sells it. If it isn't available, you can buy another Medigap policy. The Medigap policy can no longer have prescription drug coverage even if you had it before, but you may be able to join a Medicare drug plan, which is Part D. If you joined a Medicare Advantage plan when you first were eligible, you can choose from any Medigap policy. All right, slice of the pie number 4. Are you paying a premium for your Medicare Advantage plan and want to explore the options for a plan that perhaps has a 0 premium? There are lots of plans that have 0 premiums. When we present 0 premiums to folks, there's a lot of disbelief in the sense that folks don't see that they could be as well cared for as if they had been in the past if they're only paying a 0 premium. We have been in the Medicare Advantage space for a few years now, and the premium plans that are offered have only gone down in price, with one exception, and continue to do so for 2024. The coverage didn't change, even though the price has come down. That theory being considered, there are several other plans that don't have premiums at all. It's worth looking into, and we have a computer program that can compare them side by side so you can see the comparisons on the screen in front of you. Bruce and I love giving you all the ingredients of the Medicare pie. If you'd like to discuss the options available to you this annual election period, please call our office. The phone number is 970-549-0410. I beat you to it, Bruce.
I tried to get to it. I really did.
Or you can go to our website at mesabenefits.com to set up an appointment and we are your guide through the Medicare insurance process. I think that covers it.
I think we're good.
Perfect. Okay, let's do this again next week.
What's our phone number?
970-549-0410.
There it is.
Let's do it again next week, Bruce.
All right.
All right, this has been the Medicare Easy as Pie Show. I'm your host, Stephanie Garcia Hagan.
Thanks for listening. This has been Medicare Easy as Pie with your guide through the Medicare process from Mesa Benefits here on 1100 KNZZ.